And we've drafted this bill specifically in response to the government's plans for healthcare legislation that was revealed in a leaked document that shows that their plans are to amend the various health acts in the fall, which, in our view, in a way that will exploit loopholes and weaknesses in the Canada Health Act in order to expand the scope of private healthcare delivery in the province, to allow doctors to operate both in and out of the healthcare system, to allow user fees and a number of other elements that this government has been pursuing ever since the Mazinkowski report. And this is the agenda of the Progressive Conservative government. Our bill, on the other hand, specifically focuses on a progressive public interpretation of the principles of the Canada Health Act. So, for example, it includes a commitment to cost-effective health care, government-wide attention to the social determinants of health, and to strengthen the principles of the Canada Health Act, specifically public administration, comprehensiveness, universality, accessibility, and portability. It will specifically prohibit extra billing. It will prohibit preferred access for membership fees to private clinics or other charges. It will ensure that there is reasonable access to health care on a regional basis with defined maximum distances for care. It will expand insured services through a plan by the end of 2012 to ensure access to prescription drugs is not impeded by cost, and dental services for those under 18 years of age and those over 64 years of age are insured, with the exception of cosmetic dental services. It will require all insured surgical services are delivered in public or a charitable or non-profit facility by the year 2015. It will establish a healthcare planning council to ensure clear timelines and appropriate long-term planning and coordination for infrastructure, capital spending, and human resources, with annual reports to be tabled in the legislature. And finally, it will make the Minister of Health accountable to the legislature for health expenditures and the operation of the public health system, including properly detailed budget estimates included in the government's budget and approved by the Legislative Assembly, rather than the current general few lines for billions of dollars for Alberta Health Services, and require regular public consultations by the Minister using elected regional health advisory bodies. So what we're trying to do here is to show the kind of legislation that could be introduced, that should be introduced, and if we were the government, when we are the government, we will introduce in order to ensure that the healthcare system is strengthened in its public dimensions, and to put an end to privatization experiments by the Progressive Conservative government and the Wild Rose opposition.